Why are antioxidants so essential and complementary to treating
Yeah, let
hormones?
me, some of you may know I've a genetics research background and definitely a hormone replacement therapy background. Oxidative stress we know oxidative stress modifies estrogen receptor structure and function, progesterone receptor structure and function. Every single we know that there are good studies about steroid hormone receptors and oxidative stress and their function. So if you don't have, if you're not optimized, if your antioxidants are not optimized, then there are more oxidative stress in those receptors, which leads to the decrease of the function of that receptor, which leads to the decrease of the function of that hormone. We know this very well when it comes to the HPA axis and when it comes to adrenal stress. We know this extremely well. So this plays a powerful role with hormone management. If you're not managing nutrition, if you're not managing oxidative stress, and you have a hormone replacement practice, you're doing partial hormone replacement. That's the bottom line.
Okay. Awesome. And you're finding your patients are holding on to their hormones and getting much better results when their antioxidants are high, right?
The mistake we make in hormone replacement therapy is, especially in testosterone replacement. I see this a lot in testosterone replacement therapy. I know some of you guys out there do hormone replacement. Biggest mistake I see is, oh, Dr. Gonzalez, or Dr. Hormone Replacement, my symptoms are coming back, but I'm on the same dose. Well, okay, let's increase the dose of testosterone. Okay, that's fine, all right. And then 6 months it works, a year it works, everything's fine. But then, oh, Dr. Hormone Replacement, I'm getting my symptoms back. So what do? Oh, we increase the level a little bit more. And next thing you know, you're on high levels of testosterone and the symptoms are coming back. So that's when patients, they go seek other doctors. They go seek to get more testosterone. When in fact, what needs to happen is we need to address either an issue that's more upstream and micronutrient issue and an oxidative stress issue. And if we do that, it turns out use less and less and less hormone to be more and more effective.
Yep. So what we can do here is get this baseline antioxidant score very easily in 30 seconds, wherever that starting point is. You would start the patients on one of the Pharmanex therapies in 2 months. Their scores will improve or Pharmanex will refund them their money. So it becomes very easy to not only have the confidence that the products are going to work because they're proven to, and it's the only product on the market that's proven and guaranteed to do that, but it makes it also very easy to convert your patients into making a recommendation instead of wanting to think about it, because there's a guarantee that the treatment will work for them. And I think that's something that it's hard to find in medicine, a guaranteed response to a treatment. So, and then you'll typically see in about 4 to 6 months, your patients will saturate out, and then you want to maintain the same dose to keep them saturated, because some people will say, well, hey, can you stop once you saturate the tissue? Well, can you stop exercising once you get the results? No, you're going to come back down the hill, right? So as long as you want to get the results, you want to keep on the therapy, because your body is chewing through antioxidants every single day. Just because you ate healthy 1 week doesn't mean you can't eat for the next month, right? And so you need to get these antioxidants in your bodies and your patients' bodies every single day. The score is very easy to recommend and talk about to the patient. Low is bad, high is good. It's like a gas gauge here. These red zone is a low or poor zone. You want to get your patients into this blue or this platinum zone. I personally start at 31,000, focused primarily on micronutrients. I thought I had a very clean, healthy diet. This score told me that I was missing out on these antioxidants. And so I changed some things and switched my supplements. And now my score has been as high as 90,000 all the way at the top here. But usually I'm in the 80,000, 85,000 range. My wife started at 21,000, having lots of allergies. She's gotten her score up to 60,000. Allergies are gone. She's healthy. And my children, which I'll show you here in a little bit here, have made a huge impact too. So if any of you are seeing children or your patients have children, this is a great way to make an impact on children's health, because I've got 3 kids that are 6 and under, and the generation of kids that are being born now are the first generation that is not going to live as long as their parents. And a lot of that has to do, or almost all that has to do with the metabolic issues that are happening because of our diet and our lifestyle. So your smokers, your cancer patients, your ill patients, your diabetic patients are down here. Your average American is not much better. We can see huge improvements on this nutritional therapy here. And Ben, maybe this is a good time. Maybe you can talk a little bit about why it's so important for diabetics to work on improving their antioxidants with some of the supplements that PharmaNex offers.
The two tools, the two visuals that I give my patients immediately that work immediately, have immediate impact, are of course the color scores. Red is bad, and of course green is good, blue is good, silver is good. But I give an actual grade score. So if somebody scores in the red, I give them an F, and I say, look, you got an F when it comes to your nutrition status. You get a D minus, and I'll go as far as D minus, D plus, C, C plus, and all that. And that really plays a powerful impact on an individual right away. It gives them that visual, because everybody thinks about grades, grades, right? So that works. And then what was that question again, Steve?
Diabetic. Why is oxidative stress and antioxidant therapy so important?
Okay, if you're physicians, medical providers, do I really need to talk about oxidative stress in the diabetic? Do I really need to do that? Obviously, there's oxidative stress in that diabetic, and then and that's we worry about all those issues on cardiovascular effects of oxidative stress, the neurologic effects, the peripheral neural effects, oxidative stress in diabetics. So as you're trying to work with your patient to bring down their hemoglobin A1C and improve their sugars, their blood sugar status, you also need to think about their oxidative status. Improving both of those biometrics will exponentially improve their baseline physiology processes.